Welcome to the Modern Patient Experience, a show about how U.S. healthcare is adapting to new patient expectations. I'm James Furbush, Director of Marketing at Access One, a company that empowers revenue cycle teams to help all patients effortlessly pay for care in full or over time. In each episode of this show, I interview executives from hospitals and health systems, physicians and nurse leaders, digital health pioneers, and others to better understand what it means to be truly patient-centric. The goal is to serve up new ideas, frameworks, and tactics that will help your organization give your patients the best clinical, financial, and operational experience. And away we go. Welcome back to this week's episode of the Modern Patient Experience. I'm your host, as always, James Furbush. My guest this week, very excited to have her on. We are going to dive into the family-centered care model of care. And I couldn't be more excited to invite Charlotte Safran on the show to discuss that. Charlotte, welcome to the show.
Thank you so much, James. Yeah, it's a pleasure to be here and to be talking to y'all. Super excited to, I think a lot of folks in healthcare are interested, adjacent to patient and family-centered care, but I'm excited to help demystify it and help health systems really figure out, like, this is really, we can do this. It's not rocket science.
I'm excited because frankly, I know very little about it. I'll just cards on the table. And so I'm excited to have this opportunity to learn from you, share with our audience to do exactly that, kind of demystify stuff. So I'm couldn't be happier to have you on the show. But just for our people listening, can you just tell us a little bit about yourself, how you got into family-centered model of care? I'd love to just hear about your background.
Yeah, absolutely. I am from Vermont, and one of my favorite authors is Robert Frost, who also lived in Vermont. And he wrote once, "The afternoon knows what the morning never suspected." And that quote really, I think, aptly describes my journey into patient and family-centered care. I have 3 children who are incredible, and my middle child, who actually just barely turned 17, he has a really rare genetic condition. So he's got a lot of medical complexity. And gosh, my degree is in education. My background is in like education, family systems, human services, and that's where I spent the majority of the beginning of my career. And then personally, helping my family, my son, navigate through the medical system, navigate through the healthcare system. I learned a lot about the importance of patient and family-centered care. And I was really lucky to have the opportunity actually to develop and manage our local children's hospital's patient and family-centered care program. And I now work for our health department up here in Vermont. And I have a consulting firm called the Partnership Collective, where I, really, again, like support health systems on building patient and family-centered care mechanisms. But that's a little bit about how I got here. Some professional background in family systems, but really my personal experience in supporting my son and our whole family navigating the healthcare system.
I love that. I mean, it does go to show, all care it's like personal in so many ways, healthcare. And it's great. I mean, being able to tie those two things together, obviously the experience you've had with your son and now bringing that professional setting and a consultative setting for health systems as well is pretty remarkable. Not everyone gets the opportunity to take one and apply it to the other.
Yeah.
Very quickly, let's just like level set. And let's start at the beginning, because I'm sure there are probably plenty of people, even in healthcare like myself, who are like, what is this family of care thing? And like, what is it? And like, why should people know about and care about it?
Such a great question. Let's make the implicit explicit here. what are we even talking about? First of all, I want to definitely shout out to the Institute for Patient and Family Centered Care. They're an incredible organization that was really foundational in a lot of my learning about, oh, this is an actual framework. Patient and family centered care is really a way for healthcare systems to center dignity and respect, information sharing, participation, and collaboration. Those are the pillars of patient and family centered care. And really thinking about, might we, patient and family centered care is really how might we shift power, co-create with patients and families rather than one directionally doing things to patients and families. Of course, healthcare providers absolutely often know a lot of important things when it comes to clinical care of patients and families. And what patient and family centered care does is really honors that expertise and also honors the expertise, the lived experience of patients and families. So patient and family centered care really, it happens at all levels. It happens at the bedside and it happens up at the policymaking level. Like, how are we making sure that we are informed by patients and families at every point of care?
That's awesome. Can you, is there a way you could, a concrete example, maybe from your own background of, okay, that's in the abstract. In
Mhm.
reality, what does that sort of look like?
Yeah, exactly. What does that look like? I would say, I'll give a few examples. At the point of care, it could mean ensuring that we providers are co-creating a care plan with patients and families. It could also mean thinking about shifting perspective from visiting hours to welcoming hours. When might we welcome patients and families into care spaces? At kind of the more like policy level, it can look like thinking about how might we as a healthcare system think about really formalizing how we invite in people who've utilized any of our hospital services and might have really valuable wisdom and expertise to share with us. How might we invite them onto advisory councils, quality improvement initiatives? How might we invite them into capital improvement projects? So, those are some ways in which I've helped healthcare systems think about how to actually operationalize patient and family centered care.
Oh, interesting. So it really does sound, and feel free to, if I'm off base here, correct me if I'm way off base, but it really does sound like the ability of a health system or hospital to really actually or involve families, patients, whatever, with the uh, care that they receive. Is that
Yeah.
kind of one
Yeah.
way to think about it?
With the care they receive, again, at the point of care, and also thinking about how to improve what things aren't available to patients and families that perhaps should be. I worked with a healthcare system on ensuring that there was a process for patients who have autism or who are neuroatypical, because that can look different coming into a healthcare setting, can be overwhelming for anybody, and it can look really different. So we really provided a way for every person who has autism and or is neurotypical who comes in, there's really a way to support them throughout their hospital stay. And we also, with the hospital system I worked with, created a program for trans youth, trans and non-binary and gender expansive youth, which again is very critical. Youth who are non-binary, gender expansive, transgender need a safe and affirming space to receive health care. So it's not only helping hospital systems think about how to provide quality care, but also what maybe isn't being provided and what should be being provided based on what we're hearing from patients and families.
Yeah, that's fantastic. I mean, it sounds, I mean, obviously, like health equity comes up quite a bit. And so it sounds like it's a very tangible way to make spaces more welcoming, more equitable for, and as you mentioned, like someone on spectrum where alarms and things might be a little jarring,
Yeah.
not welcoming. Sounds like it really plays a role in the fostering and doing, being better about health equity initiatives.
Yeah, absolutely, absolutely. If you have a strong patient and family-centered care program and or if you are thinking about doing any diversity, equity, inclusion, belonging work, it's imperative to think about that in tandem with patient and family-centered care. As we know, Black, Indigenous, persons of the global majority have been marginalized, have been harmed by healthcare systems. People in the LGBTQ plus community have been harmed by the healthcare system. And I'm talking about systems here. I'm not necessarily talking about individual people. And it's important for us to name that. I use the phrase organizational humility to have some humility around our role in being able to change those systems and really creating space that is safe and affirming for people to talk about their experience, to talk about the generations of harm that have happened, and for healthcare organizations to truly be able to hear that and pivot accordingly is imperative if we are ever going to think about meaningfully decreasing health disparities.
Is this sort of a way to think about how care is delivered and decision making happens? Is this only, is it mostly for, say, pediatric, where it's kids with their parents, or is it, and where I'm going with this in my head is, I mean, obviously now there's with like my mom and dad,
Hmm.
boomers living older, there's like that sandwich generation
Yeah,
I'm probably a part of, which is I am not only taking care of my kids,
right.
I am taking care of my parents. So,
Hmm.
but I just, and so I just want to make sure that I'm not thinking about it only from, oh, this is for kids and their parents. Is that,
Right. It's
it's,
yeah, that's such an important distinction, and thank you for bringing that up. Exactly. Patient and family-centered care, I think, often does happen naturally in pediatrics because you do have a child or a youth who is being cared for, and then you often have their parents or caregivers there. But patient and family-centered care is really a model, yeah, for all parts of the healthcare system. If you or your partner or your parents are hospitalized, how might you think about how might we think about how to incorporate those with lived expertise, those who know you best, into plans of care? So yeah, it's definitely for everybody.
got it. Okay. Is curious too. I want to go back. How is this? So it sounds great, right? I
Hmm.
mean, it sounds, and actually, frankly, it sounds almost a little obvious and like, why isn't every place just doing it in some ways?
Yeah.
But I mean, how do you think about how does it differ from, say, other kind of clinical decision making models and things that are out there that hospitals and health systems or provider organizations are using? I mean, is it different? Is it like, how do we think about where it's in the
Yeah.
spectrum, what's already out there?
It does seem obvious, doesn't it? Yes. Yeah, absolutely. I mean, I am somebody who is very strengths based. I love to use an appreciative inquiry approach when I'm thinking about change management. I would like to think that hospitals and health systems who aren't necessarily doing this really intentionally because it maybe feels mysterious, it maybe feels, oh gosh, I don't know the first step to take. This feels so big. I don't know how to reach out to patients and families other than in the clinical way to do. The reasons for doing this, though, are innumerable, not the least of which is decreased patient stays, increased patient satisfaction scores, increased staff satisfaction scores, which I think is incredible. We have people who are in this line of work because they care for patients and families, and to know that they are working within a robust patient and family-centered care culture makes them feel better about their work. Also, decreased costs. We have decreased lengths of stay. We have decreased costs. So putting in a little bit of the kind of preventive work. Let's talk to patients and families about what worked well. Let's build off what worked well so we can incorporate those wins into our pathways, into our flows. That actually decreases costs because it increases adherence to plans of care. It increases medication adherence. It increases health literacy. So patients have a stronger idea of what it is they're supposed to do when they get discharged. Again, I think the reason that hospitals aren't doing this is probably mostly just we don't exactly know how. So can someone teach us the steps? It really get yourself a buy-in from leadership, get yourself a multidisciplinary team, some social workers, some nurses, some MDs, some folks who work at intake, and I really recommend get a steering committee together, do some work, research the Institute for Patient and Family Centered. Exciting idea for your office, your hospital, your whole health system. Don't let perfect be the enemy of good. Research what patient and family centered care is, and then try one small step. You don't have to change the entire culture of your hospital at once, but doing one change management incrementally is huge, and it can definitely be done.
Yeah, that's great. It's a good segue. So let's say you got a steering committee, or you are interested in, I don't know,
Implementing.
how's implementing? Yeah, thank you.
Yeah.
I'm like, what's the I sent word?
Words.
What's my kind of mentor? You said perfect to the enemy of good makes would say that to me all the time. I always think, what's the don't? He would always also say, don't use a 10-cent word, 5-cent word will do just fine.
Mhm.
But implement is probably the right word. But let's say you're thinking about, okay, we got our doctors and nurses, got a steering, want to do this. We want to maybe start small. But can you walk us through what needs to happen? Honestly, if you're a health system and you want to start to dip your toes in this direction, I mean, is there a framework? Is there what does that look like? What is an organization getting themselves into?
Yeah, it's such a great question. There's lots of ways to implement patient and family centered care. I think there is a framework. I think some really important things to think about is I've used this word before in this conversation, humility. It will be really important for the steering committee to do some deep internal reflection, internal thinking on where are some of the hiccups? What are our Press Ganey? What are our patient satisfaction surveys saying? Where are the gaps? Highlight and start there. Highlight some opportunities. Oh, discharge seems to be a real problem. Or, oh, we want to make sure that we use gender affirming language. So start there and think about intake staff, front desk staff, and do your research on trainings that are available. And also it's really important to think about how might you compensate folks with lived expertise after you've done some of that internal assessment and you're ready to create a culture of patient and family centered care. But budgeting is a big part of this. In the scheme of things, compensating patients and families to participate in listening sessions or advisory councils is really budget dust. The return on investment is huge for the insight and the wisdom that you gain from having such an equitable and sustainable feedback loop.
I love the expression budget dust. Not that is the main takeaway from that point. I'm going to steal that from you.
Yeah.
That's fantastic. And Charlotte, for organizations that do start to go down this pathway, I mean, is there an end state, or what does journey look like of we start to do this? Where are we heading and where are we going to go to with this? Can you just maybe give a couple examples of what organizations can expect where they are sort of would want to head towards based on other health systems you've seen that do this really well?
Yeah, it's such a great question. I think often health systems, hospitals have the best of intentions. All right, we're gonna do this. We're gonna get a steering committee together. We're gonna get 15 patient family advisors, and we have an advisory council, and then the box is checked. Like there, we're patient and family centered, and it doesn't necessarily look like that. Definitely, patient and family centered care is actually just a culture change, and if you're doing it well, you're always swimming in it. It's definitely a journey, and it's a wonderful journey at that. It is not a destination. It's going to, when it's done well, I think organizations are going to feel they're really more connected to the community, more connected probably to population health, public health, going to feel really connected about understanding those intersections from a patient family perspective more authentically and more holistically, which is just wonderful. That's why we're all here in healthcare, is to ensure that we're all holding each other up for the best possible wellness for all of us.
Oh, that's awesome. Yeah. And then that makes perfect sense. I mean, I think having that culture change where patients do have a voice, where their families have a voice, where you're driving more equitable outcomes and partnering with the communities. And it, we hear all about social determinants of health, all these things. So that's awesome. And good to know that maybe there is no sort of perfect state, that
Right.
it's just an ongoing process of change.
Mhm.
One thing I'm curious about, I want to jump back in because you mentioned this a little bit earlier in the conversation. And you had mentioned that there are all these sort of benefits of sort of moving in this direction. And those benefits are very much, I think, aligned with how, if you're in the C-suite of a hospital or health system, right? If you're a CEO and CFO, you care about patient satisfaction score, reduced operating costs. Labor shortages are a huge issue in health systems right now. I mean, they still, since COVID, it's been 4 years, but
Yeah.
just staffing, burnout, things like
Mhm.
that. Sounds like this has some benefits to a lot of those things. But I just want to maybe, can we focus on that for just what are some of the benefits? Can we just more specifically dive back into that a little bit? Because I'm very curious. I think certainly if you're a C-suite executive listening to this, those might be the things that they do care about more than maybe the touchy-feely
Yeah.
things. And they might care about those things too. I don't want to presume, but
Absolutely. Yeah. Yeah, yeah, yeah. Patient and family-centered care is not just a fluffy golden retriever. I mean,
yeah,
that's wonderful, but it's also actual increased better outcomes and decreased costs, plain and simple. And yeah, I mean, in terms of, we could talk about the benefits on diversity, equity, inclusion, and belonging. There are absolutely labor shortages. There's also, I want to acknowledge that I am a cis het white woman speaking about this. It's just, I think it's really important to name my identity in speaking about this. And also, if you have a robust patient and family centered care culture, you are going to have a a much stronger understanding of how to create a space of healing for folks who have historically been harmed. And you're going to be able to retain, if you have a space of belonging, then your retention rates in terms of retaining Black, Indigenous, and persons of color, in terms of retaining LGBTQ plus staff and employees, that is huge. when you have a strong patient and family-centered care culture and staff satisfaction has increased and you've created more of a sense of belonging, then your retention rates are better. And that's just one example of the power of really that organizational humility. I know it's tricky, but the power of humility is huge when, yes, healthcare systems are doing incredible work. And also there's always ways to improve. And the answer lies in people's stories and really understanding them.
Yeah, that's awesome. What are some of the kind of, are there pitfalls or sort of downsides? Like, what are some common missteps or things that,
Yeah.
if you're an organization, like, what are those things that you should be aware of where this can not be done or
Right. Right. And
yeah,
actually cause harm. Yeah.
cause
It's
harm or yeah.
it's such a good question. I think it's really important for organizations when they're thinking about establishing a patient and family centered care culture is to do some of that work that I talked about a little while ago. Do some of that internal work. Do ensure that you get some of that internal buy-in. Talk talk to people who are doing that frontline work. Talk about, hey, we're thinking about doing this. There's a lot, understandably, I think there's often a lot of concern about capacity. I'm already doing the work of 10 people, and now you want me to think about the patient and family. Not that they aren't already thinking about it, but I think there's a lot of hesitancy sometimes on the pressure put on those frontline workers. One of the pitfalls, I think, is not doing a lot of that internal assessment and that taking the time to do that internal buy-in so everyone's truly on board with, oh, okay, this is going to be better. I think another pitfall is that idea of being performative, reaching out to patients and families, being extractive. Hey, can you tell us your story? Can you tell us your story of harm or your story that really didn't go well, without that feedback loop of, hey, thank you so much for sharing your story. Because you did so, it impacted the way we do X, Y, and Z. Making sure that when you're asking people to share about their experiences, to share some of their wisdom, to share some of the hard things that have happened, that you make sure and you loop back and talk about how their story has impacted the way.
That's so fantastic. This has been an amazing conversation. I feel like I've learned a lot. I feel like I want to go now and learn even more.
Thank you.
Listening, Charlotte, where can they learn more about you, learn more about family-centered model of care? What are your recommendations for just how can they get in touch with you or just even learn more if they want to?
Yeah. Thank you so much. I would love to talk to anybody. My consulting firm is called the Partnership Collective. I think it's thepartnershipco.com. If folks want to go there, and happy to meet with anybody, answer any questions about how I can support them. Another incredible place to go is the Institute for Patient and Family Centered Care. They have some really wonderful foundational resources, especially around that some of that internal learning and journey about that organizations can do. And take a risk and reach out to a patient or a family. That's how you can learn more as well.
No, it's even better. It's because that's at the end of the day, that's really what it's all about for these health systems is bringing their patients and families into kind of the care setting and the business in a more thoughtful and dynamic way.
Yeah.
I will link in the notes and in all these places. I will link Charlotte's website and the family centered care organization. So don't feel like you got to try to write those down. You'll be able to get those, no problem. And then Charlotte, I want to just thank you for making the time and giving us the 101 course of this. This has been a fantastic conversation. So thanks so much for making the time to talk to us today. Really appreciate it.
Absolutely. Thank you all so much. I'm actually gonna close this out with a quote by Rachel Naomi Reman, which is, facts bring us knowledge, but stories lead us to wisdom. And if that can be a takeaway of all of the listeners, that would make my day. Thank you so much for having me.
That is a fantastic. As a marketer and storyteller myself, warms my heart. +1 for me on that quote. I loved it. All right. Thanks so much.
Thank you.
Can't wait to see you guys on the next episode. Subscribe, like us, do all that good jazz. Thanks so much.